we need.
Let me ask you this: how do you deal with a situation when you have a patient that's like, "Oh, doc, I think we should take this a little bit in a different arena.
I need some healing.
I'm kind of I like what you've done for me, and I like you to do a little something additional.
I likes you and I want you.
How do you deal with that kind of stuff?
You guys, come on.
I mean, it happens. Does it not happen?
On The Sopranos, it happened, right? On The Sopranos, he had a psychiatrist, and he came on to her.
He hit on his psychiatrist. Okay. Well, you're right. I mean, I do have a company called PD Consulting and Clinical Services where we
Wait, what was it called? PD?
PD Consulting and Clinical Services, and what we do there is see clients, individuals, families, groups, do a lot of relationship counseling, and in a lot of individual work with men. And so if a man tried to come on to me, I'm not saying that one has ever done that. No one's interested in the doc.
You're lying, Doc. There's been like about 5 this past week alone.
Is there a picture of you right now, Doc? Is there a picture of you online?
I'm not sure.
You know there is.
I'm not sure.
You know what? See, go to ask.com.
Somewhere. But let me stay here for a second. But with any profession, including your own, if someone's coming on to you, there's a professional way to try to move that situation to a different level and to help that person understand that this is a professional relationship and not a personal one. And we just have to do what's necessary to keep the boundaries in place. If for whatever reason that can occur, then we need to probably make a decision around whether or not that client will need to terminate with the particular practitioner. Me, as the example that you utilize, we would probably terminate that relationship.
Ow.
If the boundaries remain too
and then
they remain crossing those boundaries.
And then now they have a mental issue now. So now they got to go to somebody else to get treatment.
And a sexual issue.
Because
we would terminate that process, but we would certainly make sure that we referred them to an appropriate service and transferred the necessary records.
So you don't pass them off? So that's how the doctors do? You don't pass them off to each other?
Pass it, Dutch, on the left hand side.
Well, if the boundaries are crossed, the most important thing and the priority is that this client is served first and is served well and that their needs are met. And so if for whatever reason they're so infatuated with the docs and not willing to engage in the service, then we need to do what's best for the client.